Okay, now it's recording. Okay, today our topic is knee joint. First, we'll learn about anatomy of the knee joint, then the biomechanics and clinical anatomy. Is that okay? Okay. You have no option to unmute yourself. That's why. Okay. Okay. Today, let's learn the knee joint. Knee joint is a very complex joint. It's a synovial joint, so it is a true diarthrodial joint. Okay. Knee joint is between the lower end of the femur and upper end of tibia. Lower and upper end of tibia, that is, this is the lower end of femur, and we have another component added, that is by patella here. Okay. At the upper end of the tibia, we have two joints. This is knee joint and this is superior tibiofibular joint, right? This is inferior tibiofibular joint. Okay, so this is the lower end of femur, this is the upper end of tibia, this is fibula. Fibula don't participate in the formation of the knee joint. Okay, always remember that. And also fibula don't participate in transmission of body weight. Okay, fibula don't participate in the transmission of body weight also. And here is the patella. So this is the knee joint. Okay, this is not a knee. Okay, only this is the knee joint. Okay, knee joint is again has two components: patellofemoral joint, patellofemoral joint, the joint between these two, patellofemoral component, and what is this? Tibiofemoral component. Okay, let me unmute. Okay, now you can unmute yourself whenever you want to talk, but don't talk unnecessarily. Okay, please, because this is recording. Okay, clear? Knee joint is a complex joint formed by patellofemoral joint and tibiofemoral joint. Okay. Okay, you see, this is the joint space. This is the joint space. Okay, all of this is joint space. And this is not a knee joint. This is very important. Okay. This is the knee joint. Knee joint is a synovial joint modified of a modified hinge variety. It is not typical hinge joint because it undergoes some degree of automatic rotation during flexion and extension. Actually, it is a compound joint consisting of three articulations: right and left condylar joints between the condyles of the femur and tibia, and one saddle joint between the femur and patella. And patella is which sort of bone? Patella is
Sesamoid bone.
okay, sesamoid bone. Sesamoid bone formed in the tendon of Gracilis or gastrocnemius?
Quadriceps femoris.
Quadriceps femoris.
Quadriceps.
Quadriceps. Gracilis kada?
కాదు
No,
సార్.
sir.
Very good, very good.
నో సార్.
Okay,
Quadriceps.
okay, okay. My students are following. Right. Okay. Okay. Now the screen is visible to everybody, right?
Yes, sir.
Yes sir.
Okay. So this is the diagrammatic representation of the knee joint. There is femoral component, and this is tibial component, and this is patellar component. Okay. So the knee joint has articular surfaces. Articular surface of the knee joint are medial and lateral condyles of the femur. The bones participates in the formation of knee joint are femur, patella, and tibia. So the articular surfaces of the femur are medial and lateral condyles and trochlear surface of the femur, and articular surface of the patella, and in the tibia it is medial and lateral condyles of the tibia, articular surface of the medial and lateral condyles of the tibia. Right, this is, what is this? Upper end of the femur or upper end of the tibia?
Lower end of femur.
Lower end of femur. Very good.
Lower end of femur.
Okay, done. Very good. So this is lower end of femur. This is anterior view. This is posterior view, right? Okay.
Yes sir.
This is medial condyle. This is lateral condyle. These are lateral epicondyle. These are medial epicondyle, and this is adductor tubercle. Okay. So this is the place where adductor magnus, tendon of the adductor magnus. Okay. After adductor hiatus చూసారు కదా అందరూ డిసెక్షన్ లో.
Yes sir.
Right.
Yes, sir.
Okay.
Yes sir.
After the adductor hiatus, okay, tendon passes like this and attached to the adductor tubercle, right? So in the femur there is medial condyle, lateral condyle, medial epicondyle, lateral epicondyle, and adductor tubercle, and this patellar surface is called, can anyone tell what is that surface is called?
Popliteal fossa. Popliteal fossa.
Popliteal surface, trochlear surface.
Trochlear. Okay.
Trochlear surface. Okay. This is the posterior view, and we have intercondylar notch, the notch between, okay, intercondylar notch, it is here, intercondylar notch, condyles, epicondyles, and adductor tubercle. Okay, these are the medial and lateral supracondylar lines. Okay, lateral condyle, medial condyle, intercondylar notch, and trochlea. Okay, trochlear surface under. Right. So articular surfaces of medial and lateral femoral condyles of the femur occupy anterior, inferior, and posterior surface of these condyles. So anterior, inferior, and posterior surfaces only, okay, of the condyles participates in the formation of the knee joint. Okay, they are convex anteroposteriorly from side to side. Medial condylar surface is longer. Medial condylar surface, okay, remember this. Medial condylar surface is longer anteroposteriorly and narrower or mediolaterally than the left lateral condyle. Longer than left lateral condyle. Anteriorly, they are continuous with each other through trochlear surface of the femur, but posteriorly they are separated from intercondylar notch. Okay. Trochlear surface of the femur is located on anterior aspect of the lower end of the femur. Okay, it articulates with the posterior surface of the patella. It is pulley shaped, consisting of medial and lateral sloping surfaces meeting with each other in a median vertical groove. We have already seen that the lateral sloping surface is longer than that of medial. Lateral sloping surface is longer than that of medial sloping surface. Why is that? Anybody? Why the lateral sloping surface of trochlear surface of the femur is longer than the medial sloping surface? Can anybody?
Lateral condyle is large.
Lateral condyle is large. Very good. Evaru? Varshitana?
Jagati, sir.
Jagati. Very good. Inka? Still anyone?
అంటే క్రాస్ గా ఉంటది కదా సార్ కొంచెం నెక్
Angle. Okay. We'll see.
Lower and widely expanded అవుతుంది కదా సార్. Lower and widely expanded
ఉండడానికి.
మీడియల్ సర్ఫేస్ పటెల్లాతో ఆర్టికులేట్ అవుతుంది. మీడియల్ మాల్యులస్ ఉంటుంది.
Malleolus. It's okay.
tibial కదా.
Lateral sloping surface is longer than that of medial sloping surface area because, do you know what is this? Okay. Share అవ్వట్లేదా?
నో సార్.
నో సార్.
ఓకే, అయితుంది కదా, షేర్
No,
అవుతుంది
sir.
కదా.
ఓకే.
ఓకే, వాట్ ఈస్ దిస్ స్ట్రక్చర్? Anyone?
Patella, sir. Patella.
Patella. Okay, Patella has. What is this?
Which one?
What is this?
బేస్.
Base. Okay, this is apex. Okay.
Intermediate.
What are these? What are these?
Vertical lines.
Vertical ridges. Okay, vertical ridges. ఏంటది?